Members of the press, good afternoon, and good afternoon to the Health Ministry team. Today, as you can see, we are doing things slightly differently. It's Labor Day after all, and I want to start by wishing all of you a happy Labor Day. I want to start off very quickly to go through today's presentation and the update of what has been happening around the country. First and foremost is to just re-emphasize again about the issues that we have in the previous presentations emphasized. I want to emphasize that even as we move on, even as the days go by, we must not forget what we started off by saying, that the COVID-19 disease is changing the way that we live, and it has to change the way that we live. We need to look at technology and the way we conduct official business. Over the last, in the last 1 month or so, both government and private sector have evolved the way that they do business. Meetings have become virtual. Over the last 3 days, I have had 2 meetings with parliamentary committees. All those meetings have been virtual. Yesterday, I had a meeting with the East African health ministers and East African trade ministers, and even those meetings are virtual. We have had meetings with the World Health Organization globally, and the team led by Dr. Amoth went into those meetings in a virtual way. We have been holding cabinet meetings, and cabinet meetings have been virtual going forward, and all committees of the cabinet have also been virtual. So I think there is no gainsaying that it has changed. COVID has changed the way that we do things. But in a manner of speaking, it is also a good thing, because what it means is that going forward, there will be benefits that come out of this behavioral change. The quantity of travel, for example, is going to be significantly reduced, because we know that we don't have to travel to have meetings. We have been meetings even with the Council of Governors, and those meetings have been virtual. So I just want to emphasize that issue of it has changed the way we live. The other issue is the issue of distancing and so on, washing our hands. Because of that, because of distancing, because of washing our hands, what has happened is that